And for those of you who have a condition that may not heal in the short term or could possibly require lifelong pain management, we're going to go over some of the do's and don'ts that you'll want to be mindful of throughout your treatment. So welcome back, Dr. Bearman, and thank you for being here with us again. So a couple questions for you. What are some conditions you've seen that could require longer-term pain management care, as well as what are some of your do's and don'ts that you teach your patients on a daily basis?
Well, pain is the number one reason why patients seek out a physician. And the list of conditions that can cause pain is as long as your arm. I had a physical diagnosis professor who he had a thick Austrian accent, and he said, if you diagnose common disease commonly and rare disease rarely, you'll commonly be right and rarely be wrong. In terms of do's and don'ts, first off, let's talk about concerns that people might have for chronic pain. Cannabis is probably more effective in treating chronic pain than it is in treating acute pain. That doesn't mean that if you sprain your ankle you can't use it, but it means that if you have arthritis in that ankle from having broken it, it'll probably be more effective over the long run than just spraining the ankle and using cannabis over the short run. There was a study done in 2004 by Dr. Ethan Russo and by Mary Lynn Mathra, who's RN and is the president of Patients Out of Time, and they looked at 4 of the 7 IND patients, the federal patients that have been receiving 309/10 of a gram cannabis cigarettes since sometime in the 1980s. Several of these people have pain, and what they found is that except for the underlying condition for which they were using cannabis, there were no abnormalities that were found. Now, one of the things that we need to be aware of is that many of these people, certainly in this case, were smoking cannabis, and smoking can cause bronchial irritation. But as Dr. Donald Tashkin has shown in a study that he reported in 2004, it actually decreases your incidence of lung cancer. Although I would suggest that people who are regular users of cannabis use it as a tincture form, and if they feel that the respiratory route of administration is preferable for them, that they use vaporization, because when you vaporize, you have 70% fewer irritants than when you smoke a marijuana cigarette. I think that it's important for people who are long-term cannabis users to recognize that it's very safe and it's unlikely to cause you any significant side effects. If you are a long-term cannabis user, you're probably better off using it in the tincture form, or if you must use the respiratory route, then vaporizing. Now, in regards to other kinds of things, as far as do's and don'ts, it depends on what's causing your pain. For instance, if you have back pain, you certainly don't want to bend over and pick things up. If you're going to pick up something, you want to bend at the knees. You also don't want to show how strong you are by lifting something that's too heavy for you. Those are things that can cause problems for people. A lot of times people will move the wrong way. So you want to be careful the way you move, and you want to be sure that you're not in an awkward position if you happen to sneeze. Sneezing can really cause a lot of back pain if you already have degenerative joint disease or degenerative disc disease. Another thing that you might want to do is to get yourself a bed, particularly if you have back pain, that is anything but an inner spring mattress, because with an inner spring mattress you support the weight of your body on certain pressure points, and so you're likely to wake up in the morning feeling stiff. Whereas a waveless waterbed, an air mattress like a select number mattress, or a memory foam mattress, all of which tend to distribute the weight of your body over the surface of your skin instead of having it rest on any single pressure point. Another thing that some of my patients have found useful who have back pain or knee pain or hip pain is to use shoes that have good shock absorbing material in the soles. Air cushioned soles would be good. Putting in a Dr. Scholl's cushion pad would be helpful. Buying shoes that have springs in the heels, some of my patients have found that it's been useful. Also, you can look to other forms of alternative and complementary medicine. Physical therapy is very useful. Therapeutic massage is something that can be useful. There's a technique called the Feldenkrais method that people may want to try. Acupuncture has sometimes been useful in terms of alleviating people's pain. So those are some common do's and don'ts.